Hello and welcome to the LSTM in Conversation podcast. I'm Dr. Tom Wingfield. I'm a reader in tuberculosis and social medicine and a hospital doctor in infectious diseases and tropical medicine here at the Liverpool School of Tropical Medicine in lovely Liverpool. My work focuses on the intersection of clinical TB research and social medicine. So basically looking at how we can improve care by addressing the social and the economic and the psychological realities of people affected by this disease. In today's conversation, we're going to discuss a disease that's entirely curable, yet it still claims millions of lives each year. And we're going to move beyond just the bugs and drugs to talk about the person-centered approach that we can take and is necessary to end TB in our lifetimes. And that means looking at the stigma, the hurdles of getting a test and getting diagnosed, getting onto treatment, and the deep social impact that a diagnosis of TB can carry, not just for the person with TB, but for their households as well and their loved ones. I am incredibly honoured to be joined today by Fatima Karmadwala. Fatima is a drug-resistant tuberculosis TB survivor and has been and continues to be a massively powerful advocate for person-centred care. And Fatima's lived through the realities of multi-drug resistant TB and the challenges of a healthcare system, the UK system, the NHS, that at times prioritised isolation over empathy. We've already shared our message together, Fatima and I, at the British Science Festival. And so today we're going to dive a bit deeper into Fatima's journey from a really difficult time of illness, time of diagnosis, and the stigma that surrounded Fatima during her treatment and care. And then to her incredible transition into a leading voice for change in global health and particularly tuberculosis. So Fatima, I'm delighted to be here with you. Just to go back a little bit, your journey with TB began with a very long and I know difficult journey just to get diagnosed with TB and to start treatment. Would you be able to just share a little bit about what those early days were like, about the delays that you'd faced before being diagnosed, and how that uncertainty and indeed fear, as I'm sure you'll mention, impacted you and your family?
Hi, Tom. It's great to be on this podcast. Yeah, sure. I was actually only 20 years old when I first had any symptoms of TB. I was my first time living away from home. I was studying in Liverpool, and it started with a cough, ended up in night sweats to a point where I was changing my pajamas in the middle of the night because I was just drenched in sweat. I was coughing a lot, but I had symptoms for a long time before actually being diagnosed. I used to have to go home to the doctors, so I had to travel back home. So every 2 weeks, I would book an appointment for the GP. But every time I went to a different GP, they just didn't know what was wrong. There was multiple visits to the GP, no answers, new appointments every other weekend. I was losing weight. I used to have a summer job, which I was actually forced to quit because I was coughing a lot. And that meant that I was not getting paid anymore. My parents were very concerned. As you can imagine, their daughter, whose health was deteriorating a lot, and the doctors were unable to tell us what was wrong. I was basically falling to pieces right before their eyes, and there was nothing anyone could do to help me because the people that were supposed to help me and supposed to find an answer couldn't help me, couldn't tell me what was wrong. I was reduced to a diagnosis and a risk, and I basically didn't feel like a person anymore. And even once I was admitted, it was very lonely. It was very rushed. People didn't want to talk to me, just wanted to put a mask on me. It was very isolated. The whole situation just wasn't dealt with the way I was hoping. But I was quite young at the time, and I didn't really think anything of it. And because I was the one that was ill and I was the one that was coughing, you almost start to believe that you were the burden, and everyone else around you was right to behave like that around you. And I struggled with that a lot because even once I was diagnosed, no one really wanted to talk to me or tell me what was wrong. I was kind of just left to it by myself, which was really difficult at the time.
Thanks, Fatima. I think that there's many things that we can pull out of what you've just said and that experience that you had. And I know that it's hard to go back, but it's important to go back and to share with other people what has happened as you've done, so that we can try and learn from it. And I think just to kind of bring out a few things that you said, you said that it took some months for you to be diagnosed, and you had multiple trips back and forth to your GP, to other healthcare providers, and that your family was trying to support you as well, right?
Yeah, so I think I was struggling for like 4 to 5 months before actually receiving some sort of diagnosis. And that was me. Obviously, I had a lot of symptoms beforehand, and I didn't really know that anything was wrong. And once I started going to the doctors, it took a long time for anyone to realize everything was wrong. That was including not just GP visits. I was actually going to the emergency hospital because I was feeling so sick and so unwell.
Yeah, I think, again, you knew that something was wrong. You had a kind of constellation of symptoms. You had fever, you had weight loss, you had night sweats. And actually, from what I remember, you didn't really have, you didn't have a massive cough, did you? I don't think at the time.
I had a cough. I was just not bringing anything up.
You weren't bringing much up.
A lot of people think with TB, you're supposed to bring up the phlegm and things like that, which I really struggled with.
So you had these symptoms, and healthcare workers, I think, sometimes will find those hard to recognise, especially in a low incidence setting like England or the UK. And so it means that people like you who had tuberculosis and you had some of the cardinal features, which are 4 symptoms, so cough, night sweats, weight loss and fever. But you didn't actually have all of them, and you were obviously seen by many different healthcare providers, and it just wasn't recognised. And I imagine, like you said, something you said at the end of your opening was really important to me, that you began to really question yourself, and you began to think, was this something, was that something that was related to you, and was that behaviour something that you should be doing something about, rather than actually it being something that reflects sometimes the healthcare system, especially related to an illness like tuberculosis?
Yeah, and to be honest, when I look back at it now, I really, really am so annoyed at myself for never speaking up at the time. But I feel like at the time I was only 20 years old. I was new to like living out, and I didn't have much experience of life. But looking back now, if that was the way someone treated me now, I don't think I would stand for it at all. And I think that was maybe them taking advantage of the fact that I was quite young. And I feel like if it was someone older, or I don't know, then I always try to question myself, that if there was anything I could have done differently for them to treat me differently. But I think overall, just having TB was the only matter for them. The fact that I had TB, there was nothing else forward. It was just, she had TB, she was sick. We don't want to do anything right now. We don't want to go near her. There was nothing they could do. So I think, as much as I tell myself there was things I could have done to maybe make them treat me nicer, I really think the fact that it was TB, there was no going past it.
That's difficult to hear, because I think what you're doing now, though, you said, as looking now, would I do the same thing again? Would I be the same person? Obviously, you've learnt so much through your journey, and now you're actually, able to pass on that knowledge to make other people, both healthcare workers and hopefully people from TB affected communities or at high risk of TB, aware of this. And I think, that's a really important thing to do. And I think you hopefully will be able to equip other people with the means to actually, go forward and speak up, like you said, to say, something's not wrong here, and potentially be tested for tuberculosis. I think the other thing, if we zoom out a little bit, what's so powerful and real about what you say is this is your life. This was your life as a young person, as a student, and you were having to lose a lot of the things you were doing, your studies and so on, by all the care seeking you were doing. And that happens to millions of people globally. And we know that actually about a quarter of the more than 10 million people who fall ill with TB never reach care. They never get diagnosed with TB globally. And you'd think that the UK was different than other places. We're a relatively high income country. The average for people to get, from the time people get symptoms of TB to the time they're diagnosed in the UK, is actually, a couple of months or more. And so you're not alone in that kind of delay that you experienced, I think. And that's extremely important, because it leads to both psychological stress, doubt in yourself, as you said, and also some costs, either be they educational or missing work. And so we really do need to work on how we find these missing millions of people like you who actually never get diagnosed and never get treated. And I just wondered if we could kind of maybe think about that now, moving on to some of the things that you mentioned about when you actually did get diagnosed, and maybe you can talk us through the kind of phone calls that happened and then what happened when you when you were called into the hospital.
When I was first actually diagnosed, it was just I had TB, and I was given medication for 2 weeks and sent home, told to stay at home and just take the medication for 2 weeks. After 2 weeks, I did ask if I can go back to Liverpool to complete my studies, which they were fine with. Everything was okay until maybe the second day.
Yeah.
I received a call to tell me that I had to come back to the hospital and pack a bag with me. That's all.
And that was almost out of the blue to you at that point.
Yeah, I was actually in a lecture. I was not expecting anything. But also just coming off a bit off topic, I realized that because I left hospital, to everyone else around me, even my friends at uni, I was fine. No one saw the massive pills, the boxes of medication I was taking in my room. But because whilst I was in hospital, people were like, "Oh, she's not well." When I was obviously going to the GP a lot more and things like that. But as soon as I was like started medication, it's almost as though people think, "Oh, she started medication now, she's fine." But no one really saw the effects it was having on me. So I kind of started living two different lives already, where when my friends saw me, it was like, "Oh, she's on medication, she's fine." So I had to be fine. There was no room for complaining or telling people how it was or how it was feeling, because I realized fast that not anyone understood, because no one really understood what TB was.
Yes.
And I didn't blame them, because I didn't understand what TB was until I was actually diagnosed with it. I don't think there's much on it, to be honest. I never thought I had TB because I didn't really know anything about TB. But yeah, so I was obviously got this phone call, rushed back home, got the train. And as soon as I got to the room in the hospital, the chest clinic, I was asked to go to the chest clinic, rushed into another room, put a mask on, and kept to the side, making sure I didn't really see anyone in the waiting area, almost as though I was going to infect every single person in that room. There was no calming presence for anyone or anyone trying to comfort you or anything. It was more like, we need to get you out of this area, put a mask on and thing. And bear in mind, this was before COVID, so I didn't wear a
This
mask.
was 2018.
Yes, it was. Yeah.
Yeah.
So there was no COVID, so wearing a mask was alien to me. And I felt a bit embarrassed because everyone was seeing me walking past them with a mask on, and people assume things that, oh, what could be wrong with her? And I started thinking, what is actually wrong with me? Because why am I wearing a mask when literally yesterday I was fine and nothing was wrong? What's happening in 24 hours that I'm having to wear a mask now? And once I was rushed into this negative pressure room, it was just basically a boxed room, a window that didn't open, doors that never opened because I was obviously infectious. But I think there could have been a nicer way of telling me I was infectious, rather than people just avoiding you. That was the one way I figured out that, okay, something's really wrong. I think I was in the isolation room for 50 days, and I think I saw my consultant 3 times. And even then, he didn't step foot inside ever. There was almost like there was my room, and there was a tiny little corridor where the nurses could maybe put their masks on and things like that before they entered my main negative pressure room. And he'd just basically stand there, open the door a little bit, and kind of pop his head through. And I remember asking one of the nurses, "Oh, why is my consultant never coming inside?" I assumed he would want to come and sit next to me and talk to me like a human being. Anyone would expect that. And they kind of just laughed and said that wearing the mask was a bit of a hassle, which to me sounds ridiculous, because an infectious disease consultant who doesn't want to wear a mask made me think, what was he actually trained to do? Wasn't that what he was trained to do? Deal with infectious diseases? And that probably required wearing a mask a lot.
Yeah.
And I'm pretty sure when COVID hit, he did wear one. So it's annoying
Yeah.
that just for someone who had TB, he didn't. So I quickly realized that I wasn't actually a human being to these people. I was a statistic. Sometimes I even thought I was like a guinea pig to them, where they clearly weren't prepared for a patient like me to walk through that door. It was so clear to see. Um, they were fit testing nurses whilst I was there to be able to come into my room. So no one was actually, I think only one nurse was fit tested and they had to fit test another one. So they clearly didn't know, they didn't have enough nurses to care for me at the time.
Right.
And people just avoided my room really. Like no one would come in. No one explained to me what multi-drug resistant tuberculosis is. I was made to actually Google it because no one had the time to come into my room and talk to me like a human being. I just had to remember I remembered TB, so I kind of Googled the types of TB. And
Yeah.
when MDR-TB came up, I was like, oh, okay, that sounds like something they must have said. And that's when I started Googling what was wrong. And there was, I think, and you know, when people are diagnosed with things like cancer or things like that, there's
Yeah.
someone sat next to them explaining things to them, telling that it's going to be okay or what the next steps are. But for me, it was like me and my phone just trying to figure things out, not knowing if I was going to die, not knowing anything really, because I didn't have another human being talking to me. I was looking at my phone. Big difference. The one part that really affected me was my food actually just being left on the bin. So there used to be a yellow bin in that little corridor I mentioned earlier.
Yeah. Yeah.
Um,
The waste, clinical waste bin. Yeah, I know the
yeah,
ones you mean.
yeah. So the ones where the nurses used to put their masks in and things like that once they finished using it, and the everyone expects their dinner or lunch to be given to them on their bed, especially anyone in a hospital does.
Yeah.
Um, but for me, it was a case of wearing a mask again and coming into my room and actually giving me like a 2 second conversation was too much. So it became a normal thing for them to just be like, oh, we'll just leave your food on the bin. Once we close our door, then you can come out. So I was kind of just waiting for them to close their door. Uh, Almost feels really like dehumanizing when I'm talking about it, but I was waiting for someone else to close the door so I don't infect them. And then I was allowed to take my food off the bin. And then I had to go put it back there because who was going to come back into my room to take it? No one. No one really wanted to. My shower didn't work. No one came to fix it. My mum had to bring a jug of water, a jug, and then help me have a bath with the water from the tap. But because I was infectious and wearing a mask was so alien, no one fixed my shower, and I just kind of silently dealt with it because if I said anything, how can I say anything? Because I'm the problem here. These people have made me realize that having TB is my problem, not theirs. They're all walking freely outside in the hospital, and I think I was taking around 15 pills a day. That
Wow.
probably equates to like 100 a week, and I got to a point where, especially in the beginning, taking these pills was very, very hard.
I can imagine.
Some were taken quite early in the morning,
Yeah.
and there was a time where one of taking the medications made me vomit, and I was very, very sick. And instead of pressing a call button to call one of the nurses to help,
Yeah.
um, I decided to pick my phone up and ring my parents to wake up and come to the hospital to help me.
So this
And
was right in the kind of very early on in the day, or
yeah, this was early in
yeah.
the morning. This was my
Yeah.
morning medication.
Yeah.
And instead of calling the nurses to help me, I decided to ring my parents. And that really just puts it into perspective for me,
It
really,
does.
that I didn't want to seek the help of a healthcare staff because I just didn't feel comfortable, knew I was a burden, and I just didn't, when someone doesn't have a nice face because they don't want to help you, I didn't want to deal with that. So I waited for my parents to come basically to help me clear my sick up.
I mean, the things that you're describing are, as you put it, exactly that there was an element of dehumanization, that you weren't seen as a human, that you were seen as a disease, a danger, a diagnosis, and just there was that lack of empathy and human care. And I think especially from what you're saying is just communication about what's going on. Why am I here? What is TB? What does that mean for me? What does that mean for my family? And where to go with that? I mean, how did that kind of environment or the way that you're treated, affect you mentally, emotionally? How did it make you feel about yourself, and what impact did it have on your family that, as you've said, were really obviously there to support you and really try and advocate for you? But what was your take on all of that?
I remember waking up some days and thinking, oh, am I going to die today? Like, is today the day I was going to die? Because everything was going in favor of not getting through this.
Yeah,
There was really nothing I stopped planning for a future because every time I thought about, oh, I need to do my uni work, I was like, well, what's the point? I don't even know if I'm going to make it out of this room. I have no idea what's going to happen next. No one's telling me. I'm
yeah,
just taking these medications. And I remember having the PIC line inserted, so an intravenous line from my
yeah,
arm to my chest. And I remember that being done in the room.
yeah,
And that kind of set me back a lot because I was kind of lying on the bed that I'm supposed to feel comfortable in. And the pillow that I rest my head on was now covered in blood because that's what they used to rest my arm on. Like there was no equipment. I had to have my pillow full of blood, and I was supposed to sleep on that pillow. I slept on that pillow, like, and all of a sudden it's just used as an equipment for you to, you know, do a procedure on me. I was not expecting that at all. But again, I just went ahead with it because I'm the problem, and they know what they're doing. They must be doing it right. And it kind of slowly takes an effect on you. I was very anxious.
yeah.
I did feel like a burden. I did, and I re
On your family
no, on the
or
healthcare
on the
professionals.
healthcare professionals, right?
I didn't feel like a burden on my parents ever. The only thing I was always a bit worried about was because my mum was the only person allowed to come and see me.
Okay.
Um, and from there, obviously coming to the hospital, there was a lot of parking charges.
Yes.
No one made us aware that if you're visiting someone that's been in the hospital for a long time, like a long period of time, there's some sort of reduction in fee. But we only
Yeah.
got told that when we had 2 days left. So my
So
mum
you'd
was
already spent a
paying
lot.
Yeah, so my mum was paying every day, obviously, because I was on my own all day. She'd come to see me every day. And that was parking charges. That was a lot of money. So I did feel a bit bad, but my parents never made me feel bad for it. There was never
No.
like a issue. But I obviously knew that it is a lot of money it's like £4 or £5 a day now. It's not cheap and that's petrol and everything making their way to the hospital. Um,
Definitely.
and my parents aren't fluent in English.
Yeah.
And my dad obviously didn't get to see me. He wasn't allowed to come in to see me. And he asked to speak to the consultant with a friend of his so he could translate to him
Yeah.
what was wrong with his daughter. Because as you can imagine, my dad was really worried, whether his daughter was going to make it, what was wrong
Hmm.
with her. Um, no one really knew what MDR-TB was until I was diagnosed with it. And I remember asking the consultant, and they basically said that my dad can join him on his hospital rounds whilst he talks to other patients. And I just realized that why would my dad be walking around with you trying to figure out what's wrong with his daughter? Why isn't my dad allowed a sit down conversation with you? Um, Maybe trying to explain what was wrong with his daughter rather than walking around with you, almost like we're begging you for an explanation, but we don't deserve one.
Yeah.
And
Yeah.
like you don't want to talk to us, but we're going to try and get a conversation out of you. Like we're not worth the conversation with you. That's
Uh,
how it started to feel.
and it's interesting because using that word "we," I think it brings us back to that really you from what I hear, that it was like your whole family was being treated in this same way of not giving you the information of being a burden, and essentially that element of stigma, for want of a better word. It really is stigma that even extended to your mum and dad in some way.
Yeah, yeah.
I think it's really important to kind of pause for a second on stigma because you know, we, including here in Liverpool and the work that we've done in Nepal and Indonesia and other places outside of the UK, have shown that stigma really is something that is pernicious and damaging. And often it comes from a place of, like you've mentioned a few times, that you've said that, this particular hospital just wasn't set up. People didn't know about TB. It was something they weren't ready to deal with. And often that's where stigma lies in a lack of knowledge, and then putting people or the thing in the other box, the other category, and kind of wanting to keep distance that way. Of course, there is some kind of worry sometimes about infectiousness and things like that, but that's all completely manageable. And as long as you explain to people why I wear a mask as a healthcare professional and why you would need to wear a mask at certain points, for example, I think that's all manageable. But I think without that conversation, without that dialogue, people will continue to experience stigma from healthcare workers. And I think the other thing that I think is important to note that I'm glad that you didn't experience, because you have, a strong and loving family, is that globally, actually, people can experience that kind of stigma from their own communities, and even people within their own houses, as I've seen in work from Nepal, with sometimes this causing issues within their own houses, even leading to things like divorce at times, because people don't understand the illness and what it means. And that stigma really does delay people getting to healthcare. I think it's one of the reasons that people miss getting diagnosed, getting onto treatment. And I think it probably does lead in that way to bad outcomes and even deaths of people with TB when it's not addressed. So I think it's hugely important that what you've said, and this was from, healthcare professionals who really were the people who are meant to be protecting you, but you've clearly said you didn't feel comfortable and you felt scared and fearful, even in the hospital room where you're meant to be being cared for.
I do think that if I didn't transfer my care to Liverpool, sometimes I question whether I would have actually made it, because the treatment was so bad. I don't think people realize how much treating a person just kindly when they're going through anything really, but something like TB, makes a difference. It almost feels like treating a person nicely kind of heals them more than the medication does.
Yes, yeah. I think it's a really good point. I think knowing somebody cares about you is really important for your psychological health, your well-being, and I think that can sometimes give people hope, and it can give people motivation, and all of that contributes. I completely agree with you. So you mentioned about transferring to Liverpool, and I know because we met in Liverpool, and then obviously, as we said, after you've recovered, which I know was a long recovery, you've been advocating, and you've done this through your own will and volition, and in your own time, which is really something that is incredible. And I think we're really grateful for that. And I know that it will have a good impact for people with TB. But how was that process then, I suppose, after you got to Liverpool? And I know that you mentioned one of my colleagues, Professor Davis, who looked after. I know that you feel really positively to the way that he treated you is wholly different. And so I just wondered if you could just describe what it was about Prof. Davis's kind of approach. And this isn't, just about Prof. Davis, but this is what would you like people to experience that is a good way of being cared for?
I have nothing but good things to say about Professor Davis, honestly. I honestly think he saved my life in a way he doesn't even realise. He's walking through his life day to day, not realising how much of a difference he made to mine. But like I said, if I didn't meet him and if I didn't transfer my care to Liverpool, I don't think I would have made it. He made me feel like I was his only patient. Like, all his work, it felt like he was just doing it for me, just to help me get better. All his research, I felt like he had no other patients. Like, when he spoke to me, it was as though he was just figuring things out to get me back to my health that I needed. There was never, I was allowed to contact him whenever I needed, if I was getting too sick. There was never any barriers in place. He didn't put any obstacle in the way for me. It was just very easy to contact him. Very easy to meet him in the office. Whenever I was sick, changing my medication was never a hassle. When there was a few times where I was admitted into hospital in Liverpool, and he would come inside my room and sit next to me and talk to me, and I didn't understand that because there was just a few months ago, I was in a hospital and someone didn't even want to step in the room where I was. And he was happily talking to me and sitting next to me. And it almost made me feel like, okay, I am worth something. This doctor thinks I
Yes.
am. He thinks he can help me. He thinks I can get better. And I'm pretty sure he might have had moments where he thought I wasn't, but he never let me feel like that. He always made me feel like there was a way out and, things were going to get better. Um, and I think that made a big difference to how I was recovering. Um,
Yeah.
he, I remember an instance where I went for an appointment and he shook my hand, and
Mm.
it's such a small gesture, but I was like, all this time, no one's wanted to even talk to you. And then he's shaking your hand, and you think, oh, I'm not dangerous. I'm not,
Yeah.
you know, I'm still human. It's okay to shake my hand. Like, you're not going to get sick, or you're not scared of me. And it
Yes.
felt nice that someone wasn't scared of me. And I don't think I've ever mentioned that before, but that small gesture was a big thing for me, where he wasn't scared of me. And even after I'd finished my entire treatment, I suffered with a lot of abdominal pain, like
Yeah.
severe abdominal pain,
I
for a good,
remember.
like, I think a year after my medication finished. But he never gave up. And I don't know what would have happened if I was at the other hospital. I think they would have discharged me. He made sure he got through to the root cause because every scan I went to, every test I did was clear.
Yeah.
Nothing was wrong. There was nothing showing anywhere. And I remember when he used to ring to tell me that there was nothing in the scan, when he rang me to tell me the results, I was so defeated because I was like, there's nothing showing. And that is it all in my head? But he was always there to tell me it wasn't in my head.
Yeah.
Whereas when I was in the other hospital, I did believe it was in my head. I did believe I was going crazy because surely these doctors are telling me, not saying anything to me. But he made sure that there was always a next step. There was never, and any time he rang me, even though the answer was, Fatima, there's nothing wrong in your scans, there's nothing showing, he always had something else to say, which was, oh, but we're going to do this now and try this way. And
Yeah.
he didn't stop until that abdominal pain stopped.
And I know
And
that
I
that
don't,
took a long time, didn't it?
a very long time. I think it was like a year.
Yeah.
I struggled for a very long time, but he didn't give up. Even though I was finished with my TB treatment, he didn't stop until he figured out what was wrong with me and make sure I was okay. And, and that's a big thing for me, really. And it wasn't just him, the nurses there as well were great. I used to go for my IV medication three
Yeah.
times a week. And
Intravenous
I was like,
medication. Yeah.
yeah, and it was like I was seeing my friends. It was great. I really enjoyed it. I was almost a bit upset when it finished because I enjoyed seeing them. But that's the difference that, they treated me like a human being, talked to me, made jokes with me, and I finally felt like a human being again.
What you experienced and what you're telling us here really does encapsulate person-centered care and thinking about the individual. In this case, not just person-centered care, but Fatima-centered care. Thinking about you. Who are you? What do you need? What's the questions that you need answering? How can we best care for you? And I think it's really important. It's really great to hear that positivity and also those moments of humanity that you talked about, just as you said, simple gestures, just things that can remind you, yes, I am human, I am worth something, I am somebody, and I deserve to get better and I didn't deserve to get ill. I think these are really vital things that we can overlook as healthcare professions. The other thing that I think is great to hear you say is that, I think in Liverpool, especially, we do pride ourselves on the links between the hospital, obviously, when you're needing to be in hospital and being looked after by people like Prof. Davis, and then how you get back to your life. You get back to being, doing the things you want to do either studying or working or whatever it is you may want to do in the amity. And we have a brilliant community TB team here. And I know that you particularly fond of Amina and Kate and others. And I think they do have that knack of treating people as they should do as human beings and being breaking down this kind of patient healthcare provider relationship to just being people who are trying to get through and trying to get one of those people better. And I think that's hugely important. And I suppose just to tell you, Fatima, I think you might know also, but recently Liverpool joined the fast track cities to try and get rid of TB, HIV, and hepatitis. And I think the TB community team, and I know Prof. Davis and others from our unit have been involved in that heavily. And so I think there is movement, and I think people now are waking up a little bit to the fact that in England, we are seeing rises in the number of people with tuberculosis, and that we need to do something about it. And when we do something about it, we need that not just to focus on the bug, but we need to focus on individuals, on people, on communities, and how to support people. Because nobody chooses to get tuberculosis. And for you, for example, Fatima, I know that you didn't have, it was really unclear about where this might have come from. None of your family had tuberculosis. And so it really, really hit you out of the blue. And I think it's so important to give decent information, to be empathic and human, just as you've mentioned. When you came to the kind of those positive aspects of the TB community team and coming to the end of your treatment, what's it meant for you after that end of treatment? I know you have a wonderful family and your own family. What's it meant for you, and how has it shaped things beyond treatment to become the person that you are today?
I really think that I always say that medication is always there. There's scientists that research, the research is always there. But social consequences of TB are something people often overlook. People don't realize that the feeling of being avoided and excluded can have a massive impact on someone going through a condition or a disease. And I had instances where people used to leave the room after I was discharged from the hospital. I used to have to go to appointments, and sometimes the lady would leave the room and I'd get told it was because I had TB. But this was after I left isolation. So people aren't educated enough to know that once someone has left isolation, they're not contagious anymore. I'm not going to hurt you. And it took me a long time to realize that people can't actually see what's wrong with you, because TB is something you can't see. And
Yes.
expecting people to understand was very difficult. I had an instance where I used to take the lift 3 times a week, like I said, for the IV injections.
Yeah.
And taking the stairs was so difficult, and just waiting for the lift, a man just in passing, he probably doesn't even realize the effect it had on me, but he said to me that I shouldn't be taking the lift, that I was too young and I was taking space up for other people. But I
like a
didn't
throwaway
have
comment, a kind of
yeah,
throwaway comment.
he's just said it and got on with his life, but that stuck with me. But I didn't have the confidence to tell the people that were stood around waiting for a lift that I had TB, because I already knew people would be scared of me. So I just suffered and took the stairs for ages until I realized, wait, this is something you can't handle anymore because you're getting out of breath now. And that's why I think I suffered with a lot of stigma, a lot of anxiety, and I felt like I wasn't a human being anymore. It's like almost like you're a walking disease.
Yeah.
And I felt very misunderstood in my life because I was behind in my degree. I had friends that didn't understand, and it becomes a really dark place to be. And like I said before, I didn't think I would even make it to these days of my life. Like, planning for the future was kind of becoming pointless for me. But that's why I advocate now, because I truly believe that no one should ever go through what I did. No one should be treated like a burden just for having TB. No one should Google their diagnosis or eat up their dinner off a bin. And how we treat people with TB in their moment of core need really determines everything that comes after. Just treating someone nicely just makes them feel better and heal faster. It's incredible what being nice to someone can do. Because I'll be honest, someone with TB is already feeling awful and is already beating themselves up about it. They don't need a healthcare professional or someone else making them feel worse. So really, just bad manners can just be more detrimental than people think.
Yeah.
You think you think you might be having a bad day as a healthcare professional, but your bad day could really affect someone else. Like, talking to someone rudely or not giving them the attention they need can actually really affect them and can be so detrimental, and people don't realize that you might say something in passing to someone with TB But that can stick with them. I think so many things are stuck with me that they probably don't even think about again.
Yeah.
So
Yeah.
I do really think that a person-centered respectful care should just not be an exception, but a rule within healthcare professionals. Because honestly, I didn't think I would get this treatment from healthcare professionals. I could have put my money on anyone else treating me like that, but not the people that were supposed to help. You always trust these healthcare professionals to help you. And I feel like I was just not, they were not helpful to me at all. They were not helping me get better, mentally or physically, really. And TB isn't just a biomedical problem, it's a human one. And people often overlook the fact that it is a human being behind this disease. You
Yeah.
know, there's a human being there. It's not just a disease you're trying to fix and cure, because you have the medication to cure that. But what about the human behind all this disease? There's still someone there. And I think people fixate so much on getting them better and for
Yes.
to get rid of the TB that they forget that there's also a human being that probably needs a bit of care. Maybe a lot of care, really, I think. I spent around, I think it was 594 days on treatment.
Incredible.
That's a lot of side effects and pills and injections, but more so fear, I think. I was very scared going through all this.
Yeah.
I think looking back, I kind of just went through with it day by day. It didn't really hit me because it just became a part of my life. But now that I think about it, 594 days is a very, very long time to be stuck in fear and anxiety and being made to feel like this disease is going to take over your life and no one understanding you. Um, but I also gained a voice and a purpose, which I'm very glad for. And I think getting TB and being treated this way has shaped me into wanting to advocate for better care. And I realized, and I like to advocate, that TB isn't just a disease of the lungs, it's a disease that affects dignity if we let it. And just treating people with humanity might just help them heal. You know, it makes them feel better. They feel like they have some hope, and just giving someone hope is such a big thing. So I always say that even though there's a lot of science and a lot of medication, and but don't forget that there's still a human being behind all of this that needs you.
Couldn't agree more, Fatima. And I think you kind of summarize that caring for people with TB goes way beyond pills and tests. And as you mentioned, TB is and has been named as a social disease. And although it wasn't the case for you, many people globally who live in poverty or have undernutrition, that's one of the biggest risk factors for tuberculosis. And addressing that kind of hunger and lack of money is something that will reduce rates of tuberculosis without even having pills and tests. I think the other thing that you've described and really brought to life, I hope for people listening, is the impact psychologically, as you mentioned, about stigma or isolation when you're not treated well, about the impact socially, kind of sometimes issues with friendship groups, and losing your studies, for example. And then economically, you mentioned the trips back and forth to the hospital to just get diagnosed, the trips for your mum, the parking charges, and all of these things add up. And we know that people really are pushed deeper globally, this is again, into poverty by even just being ill and seeking care for TB. And, here in the UK, as we said, a high income, low TB burden setting, those costs really do add up. And it has an impact, as we said, on your studies too. So these things are hugely important. And I think ultimately it reminds us that ending TB isn't just a scientific challenge, and caring for somebody who has TB isn't just a clinical challenge. As you said, there are people behind. It's not just an illness. There are people who are suffering who need support. And so, yeah, ending TB isn't just a scientific or a clinical challenge, but as you mentioned, it's a moral one. And I think it's something that as we approach World TB Day, that as we're recording this is just under a month away on the 24th of March, 2026, we really need to remember these points that you've said about humanity, about empathy, and supporting people with TB and their households throughout the entire journey. to become cured and also just live their lives as people. Thank you very much for the time and for sharing your story again, Fatima. And we hope
Thank you for having me.
that it was a pleasure. And remember, everybody, World TB Day, 24th of March, 2026. Let's leave no one behind and end TB.